So today is June 1st. I got a phone call this morning from my doctor's office. They finally found me an appointment for my cerclage placement, which is supposed to help me not go into preterm labor like I did with my first 2 pregnancies. So I'm just hoping that this brings me more comfort, more stability. It helps me not be as stressed during this pregnancy, because yesterday I literally fell to pieces, not knowing anything and just feeling like I'm in limbo. I'm not in control of anything that goes on with my body. Anything that the universe plans to do is what it's going to do, just like I did for my first 2 pregnancies. I pretty much went into it saying whatever's going to happen is going to happen. I know that I'm not in control. So I am 14 weeks pregnant, and my cerclage will be placed tomorrow, and I will update everyone on that procedure and stuff, because I don't know. I've never had one. I have literally never gone through this before. But I'm hoping that it's better than the other option, which is probably going into preterm labor around 20 weeks. And who knows what that leads to. With my son, it was an emergency C-section, and 12 hours later he died. With my daughter, it was living in the hospital until she was born via C-section at 37 or 38 weeks, I think. But I lived in the hospital the whole time. And so I'm hoping that this is the better option. I'm thinking it will be. They tell me that it will be, so that's good. They're pretty confident. I follow some blogs. I follow some people that have gone through a cerclage. I've reached out for help for that. And I'm actually starting my own thing for women that have high-risk pregnancies, abnormal pregnancies, and just feeling alone, because I feel so alone. My partner, who tries very hard, this is his first pregnancy. He's never had kids. I've had 2, and they've both been the worst experiences of my life. Not the kids. Well, my son died. My daughter is the biggest blessing in the world. But my pregnancies are literally, I hate being pregnant. I'm not even happy right now. I'm literally at an all-time high depressed moment in my life, which is sad. Most people are really happy being pregnant. And I do feel blessed. I do feel blessed because there is a life, and I am in between worlds right now. I'm feeling like, I'm half in the ether, half on earth. But I'm depressed because being pregnant is so stressful for me. And I have to do Lovenox injections every night, and I have to get this cerclage, which I don't know if it's going to work or not. And then I'll be getting some injections weekly that is supposed to help prevent preterm labor or miscarriage. I don't know any details. So I just feel very out of control. I feel very, I don't know how to explain it. I just feel very poopy. And I think that's why my depression is really high. Also, I had in the back of my mind that maybe this pregnancy would be different, as in because I've lost 150 pounds and I've changed myself so much health-wise, that I had changed the chemistry in my body, but I didn't. I still have a protein S deficiency that causes miscarriages and blood clots, and that's why I have to take Lovenox and get all this stuff done. I still have an incompetent cervix, which is why I have to have the cerclage. And just from, life experiences, I still suffer from depression and anxiety. So yeah, there's things like that, but I'm using my tools. Yesterday I went for a walk. Today I'm gonna walk. I journal like crazy. I've been writing so much stuff down, along with how did I manifest this pregnancy? The truth is, we were trying to have kids a couple years ago, and a doctor told us we would not be able to have kids. So I went on with my life just thinking we wouldn't have kids. But I did manifesting and spell jars to manifest this pregnancy, technically. And it ended up working. So I'll be writing about that too. It's just a crazy experience. Just all of this. I'm 33. I wasn't planning on having any more kids. So we'll see how this all goes. I'll keep you guys up to date on the cerclage. Probably keep you guys want to know what being pregnant like is after a tummy tuck and a massive weight loss. There's so much things to be stressed about. Honestly, I'm just so overwhelmed with life. But this is where we are, and this is what we're doing, and there's only one way, right? You only go forward. You can't go backward. You can't take it back. Not that I'm saying I would want to. I'm just saying there are days when I physically feel like I can't do this. I don't want to do this. Yesterday was one of those days. The night before that was one of those nights where I'm like, I'm done. I'm giving myself my injection and I'm just like, I'm done. I don't want to do this anymore. I don't want to do this. I want to be pregnant. But there's only one way out, and I'm not doing that. Actually, there's only one way out, and that's going forward and seeing where this leads. Anyways, here's to hoping that tomorrow goes smoothly, and I will keep you guys all updated. Thanks for listening. Wait up for tomorrow. So today's the morning. I'm gonna have my cerclage done. Pretty nervous to see how this goes. Scared to say the least, but this is it. I'm gonna be on my way to the hospital to have it done. They're gonna do it in labor and delivery just for me. Usually I think they do it in OR, but they're having a specialist do it for me. So just got a shower. We're gonna head over, have a ride. They told me I'd have to have a ride. So I'm gonna head over and we will see how it goes. Well, I'm hooked up to an IV and I'm waiting on my spinal anesthesia. I'm scared out of my mind because I've never done this before. They say the procedure only takes like 2 minutes, but they have to do ultrasounds and several things. And then they'll watch and monitor me, make sure I don't have any adverse reactions, make sure the baby's okay. So we'll see what happens. I'm just waiting for the anesthesiologist to come back, I think. Yeah, I'm nervous. Literally waiting because my labs haven't gotten back yet. So I'm waiting. Correction on that thing before I said about how long it takes. They said it's going to be like a 5-minute procedure, and then they watch you for a couple hours after to see how you react to anesthesia and how the baby's doing. So now I'm just waiting to actually get in and get it done. I got here at 8:30. It is 10 till noon. So we shall see how it goes. So the doctor came back and explained like the risks, and the benefits obviously outweigh the risks, but the risks are overwhelming me. I just can't stop crying. One is that they can break the water. 2 is that there's like 2 different kinds of infections I can get. 3 is that if I go into labor while I still have the cerclage, that it could just rip through my cervix and then I'm bleeding out. I know that the other option, not getting it, it's not a good option because I'll go into preterm labor for sure. I'm just terrified. Absolutely. I'm scared of what's going to happen. I'm scared And I'm just kind of wishing I wasn't in this position at the moment. Because I don't like being this scared and this anxious. And these are the things that make my depression get really, 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 really bad. So here we go to more waiting for this surgery. Well, I'm out. I'm officially out of surgery. That is, I mean, what part of pregnancy isn't humbling? That was definitely very humbling. But they said everything went well. They did they called it like a purse string suture around my cervix, and then they leave some like hanging down so they can find it and cut it off later, around 36 to 37 weeks, they said. My anesthesiologist was amazing. Shout out to Gavin, my new best friend, because I did not feel anything. I felt some pressure in my uterus, like I could feel it moving, the tugging. That was uncomfortable, but I didn't feel pain. So, I just got home from the longest, most draining, most emotionally draining, and most triggering day ever. I got my cerclage. I was at the hospital from 8 a.m. to 8 p.m. It was the longest day ever. They told me I'd be done by like 2, that I'd go home, and I didn't even get into surgery until like 2:30. The surgery itself took like 5 minutes, but they monitor you till like your anesthesia wears off, which took until like 7. I attempted to start walking at 6, but I almost fell. Then they waited until like 7:30. Then I could not pee, so they were gonna keep me, but they ended up doing a catheter, and then they told me they were gonna keep me anyway. So I just like was so triggered because of my past, and like the fact that they would keep me, like if I would just be at a routine appointment, they would keep me. And I was like crying hysterically, like I am not staying here. I want to go home. All I wanted to do was go home. So now I'm home. It took 12 hours to get here. I mean, everything else as far as like the actual cerclage and everything they said was good. The baby was good. I don't have any extra bleeding. That's unplanned. And I have a prescription to go home with, which I'll go into more detail because I didn't really read it. I know that it's about like, one is to stop contractions, and then another one is for like an antibiotic. But I'm just exhausted. I'm emotionally drained. I spent the greater part of my day in tears, completely freaking out. So yeah, this is like so fun. But I will update everyone on how it's going and how everything pans out from here. So I'm gonna give like an update on my cerclage surgery, which was officially 1 week ago. So I'm 1 week post-op yesterday. But everything went as planned, and it was just a really long day and ended up being really a stressful day. Like, I think I left there like tired and crying. That's a new word, cried. And just a like emotional wreck. Just from being there for 13 hours, and the procedure was only like 20 minutes. So it was exhausting. But I just wanted to talk about like post-op and like so far this last week, how it's been. I know the day after, I had soreness, and I did take some Tylenol. So I'm also on Lovenox, and I can't take any type of like blood thinning painkillers. So they told me that I could take Tylenol. I'm also on antibiotics that ended today. And just in general, like the soreness kind of lasted. I mean, I'm still kind of sore, but I think I might be overthinking things. I know for the first 3 days it was like the worst, and there was bleeding and there was cramping, and I was on this medication that stops contractions just in case there's contractions. And I didn't really feel contractions, although I did feel like cramps. They could have been like little minor contractions. I didn't feel like period cramps, so it was nothing really bad. Yeah, the bleeding and everything lasted about 3 days. There was no abnormal discharge or anything, so that's good. I've never had a cerclage. This is my first cerclage, because all my other pregnancies have just either ended preterm or started to go into preterm labor. We know that my cervix is incompetent, so that is my diagnosis and why I needed it, why I needed a cerclage. I am more calm, although I did go through a really bad bout of depression during this last week. It was a really, 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 like the most depressed I've been. I mean, maybe not the most depressed I've been since I found out I was pregnant, but like this whole pregnancy has just been an emotional roller coaster. And I was really, really, really depressed on one day. And I know that sometimes when you're coming off of, what is it called? Like the anesthesia and stuff, like it does cause, like if you've had depression before, it can like kind of stir up depression. Any kind of surgery or operation does bring up like depression problems if you've had depression. I've noticed that with any surgery I've had. I've had a hiatal hernia surgery, I've had a tummy tuck, I've had two C-sections. It does just kind of cause depression. So I did have that during this week. I think it was also just because I wasn't moving as much as I'm used to moving. I like to be active. I like to do my yoga, and I like to go for walks, and I couldn't do any of that for a few days. I'm obviously not allowed to, I'm not on bed rest. So that was one thing. I don't want to be put on bed rest. I don't want to be hospitalized. Those are things that happened to me before in the past that I don't want to happen now, which is why the cerclage is important. I could still go to work. I just can't exercise during the heat of the day. I can't go for my walks when it's really hot, and I can't walk as long as I was walking at one point, like in time. I have to like kind of like spread it out. And then my yoga is just more gentle yoga now. But I do those things for my mental health, because my mental health is very important. Obviously, I'm talking about depression and having anxiety problems. So I'm doing these things for my mental health, along with my breath work and being in my mastermind group with a bunch of supportive women. And this pregnancy, I do feel a little bit like more supported by like people that I don't even know. So that's good. Just because I'm not really telling anyone at this moment. And it's just me and my family, me and my daughter and my partner that know that I'm pregnant, and my best friend. And those are my support systems. This is all I have right now, just because I need some positivity, and I don't want to deal with negative vibes and stressed out vibes. And I know that a lot of people will stress out if they find out that I'm pregnant because of my previous pregnancies being a wreck. So I just decided that I want to go through most of this on our own, and then I'll share my story as I'm ready to release all the stories. So that's what my update is this week. I'm going on 16 weeks, so we will see how it goes. Right around 18 weeks is when things went bad for me in my first pregnancy, and right around 25 weeks is when things went bad in my second pregnancy. So I'm just like have this like marker in my head. I'm like, just get past 27 weeks. Let's do that. Like, let's just get past 27 weeks. that is so far ahead from where I am right now. That's like almost 10, like that's over 10 weeks away. So I'm just saying, like, let's get to 20 weeks. Let's get to 20 weeks and hope that there's no problems. And I'm just gonna keep talking and keep blogging and keep vlogging or writing in my journal. I have a journal that I'm like trying to like write as much as I can in, so that way I remember what I want to what I want to remember, what I want to release. But yeah, so week post-op, that's my update. I'm okay. I'm able, today I went for a walk. I was really keeping myself inside, and I did go to work a couple of days, but I'm home today. I mean, since then I've worked at least 4 days, so I've had a few days off. But yeah, so that's my week update. And I know not everyone's story is the same. I know some people have an emergency cerclage placed and then they're on bed rest for the rest of the pregnancy. Trust me, I know what bed rest is like. I was hospitalized and then put on mandatory bed rest without any movement. I could not go anywhere. I could not use the restroom. I could not take a shower. I could not do anything. And I was in the hospital. So I was literally like a little prisoner. So I know what that's like. And that's the one thing I'm avoiding. That's the one thing I'm praying doesn't happen in this one. So let's see what happens, what unfolds in the next week. And then I will let you guys know. Thank you.